Welcome everyone to the Sexual Abuse to Prison Pipeline web conference, a series for the Power and Prevention Ending Child Sexual Abuse web conference series. Power and Prevention Ending Child Sexual Abuse web conference series is a national project of PreventConnect and the California Coalition Against Sexual Assault with support from the Ms. Foundation for Women. The views and information provided in this web conferences do not necessarily represent the official views of the Ms. Foundation for Women or CalCASA. Your series co-host today is Cordelia Anderson and Joan Tabachnik. Welcome, Joan, and welcome, Cordelia.
Thank you. We're delighted to be here. I'll start by doing a little introduction and then turn it over to Joan. We're delighted to be part of Power and Prevention, and especially the session on the launching our series for this year, the Sexual Abuse to Prison Pipeline. And it's exciting to co-host this again. I am someone who has worked in prevention for nearly 40 decades, and I'm very excited to be part of this series. Joan?
Great. Well, my name is Joan Tabachnik, and I'm also thrilled to be part of this series. And one of the things I love about working with Cordelia is that even though they're the same age, she makes me feel young. I've only been doing this for 2.5 decades. And I've been focusing more on really on child sexual abuse prevention and preventing the perpetration of sexual violence. And I'm currently in the fellowship with the Department of Justice. Back to you, Cordelia.
Well, we're going to be talking now, this next slide captures our learning objectives. And it's very simple. We want to describe the connection between movements. So often there's a silo like between sex trafficking, sexual abuse, child welfare, and this really is going to get at some of the connections. We're going to be describing the new report, the Sexual Abuse to Prison Pipeline, and we want to help understand the importance of really engaging the child welfare and healthcare systems in prevention of child sexual abuse, which is why it's so great to see the range of fields that are here on this with us today. The next slide is all about intersectionality, and this is a word often defined as a noun, the nature of social categorizations such as race, class, and gender as they apply to a given individual or group, regarded as creating overlapping and interdependent systems of discrimination or disadvantage. And this report really gets at a very different, a very clear view of the intersectionality that we need to be thinking about if we're really truly addressing the needs of girls. At the National Sexual Assault Coalition or conference, there was a great deal of attention to intersectionality. The movement to end violence is really encouraging us to address this more thoroughly. Just Beginnings Collaborative is encouraging attention to intersectionality around child sexual abuse. Without it, we don't attend to the whole person needs. Without it, we don't attend to the whole community needs or engage all the systems that are needed. Joan?
Great. So in the next slide here that we're talking about really sometimes was talked about in a number of other of our webinars around the ASA study. And most people I think on the call have heard about ACEs and hopefully have heard about the impact that trauma can have on neurodevelopment, on social, emotional, and cognitive development, on engagement with risky behaviors, disease, disability, and even early death. What we've not talked about quite as much on our webinars is about the links of what we know about adverse experiences and how our society responds to those, and how society responds to these increases in risky behaviors and emotional and cognitive development. And that's what I'm most excited about today. So in the next slide then, one of the things that we are also sort of exploring is we want to talk about specifically about what are the kinds of risky behaviors. And certainly they can be drinking, they can be use of drugs, but they also can be sexually problematic behaviors. So in an abusive situation, a child may be taught or learn sexually abusive behaviors and then react to them. That's often called sexually abusive reactive child or adolescent. They may mimic them. And these, we have to remember that these are victims, even if they are acting out that abuse and harming other people or harming other children. But we also don't want to forget that some of these are problematic sexual behaviors. And so the larger problem that we've not talked about on our webinars before is how we respond to this range of child and adolescent problematic sexual behaviors, in particular the growing concern about how we have criminalized those responses. Most commonly, I think we've acknowledged as a girl who lives in an abusive home, runs away, enters into sexual behaviors with adults and maybe is arrested. So there are many places. If you think about that trajectory, there's so many different places where we could intervene, and we have chosen in the past at least to ignore them in many cases. This report, I think, will give us some exciting new opportunities to explore and think about that. Back to you, Cordelia.
And this next slide, I really want to thank Paula Schaefer, who's a long-term advocate in Minnesota for addressing the specific gendered needs of girls in the juvenile justice system. And one of the things that I know you'll be hearing when Lindsay gets to talk about the report is that some of this information has been attended to in different states for quite some time and across our country. And this report gives us an opportunity to really put some energy back into it. But as a Minnesota-based person, I certainly remember the Minnesota Action Plan on Female Offenders report back in 2002. And our first statewide conference that I was able to be part of on the Minnesota Conference on Adolescent Females in 1991. And all of this was to really put attention to the fact that we don't have statewide leadership or a unified approach to juvenile justice in our state or in the United States for girls or boys in the way we need it, and particularly one that looks at specific gendered needs and particularly addresses race and culture along with gender. The closest is the Juvenile Justice Delinquency Prevention Act, which was reauthorized in 2002, and I know we'll be talking more, and hopefully you can be entering in your ideas about different ways that is being looked at and updated again now. But the essence of this report back in 2002 will really echo some of the things you'll hear about today, in that girls are at an intersection of numerous social systems such as public health, human services, criminal and juvenile justice, housing, education, employment, and treatment. And the degree to which their gender and cultural needs are recognized, acknowledged, and met in these systems can either interrupt or perpetuate the intergenerational cycle of crime, poverty, chemical dependency, and abuse. That from the 2002 report. And the next slide is about, again, thanks to Paula Schaefer, but I loved this depiction of advocate warriors for girls, for equity, for intersectionality. We're advocates, and advocacy is the act of pleading or arguing in favor of something, such as a cause, an idea, or a policy. It's that active support. And in many ways, and I know it feels like this a lot to us, we're warriors. A person who's engaged aggressively or energetically and actively in a cause or a conflict. And this report is, again, a call to action to pay attention to some of our most hidden, marginalized, and quieted voices in the system. So we hope that, and we do have a picture of the report, The Sexual Abuse to Prison Pipeline, The Girl's Story, and hope that many of you have seen this. And it is now my pleasure to introduce one of the authors of that report, Lindsay Rosenthal. Lindsay, we're so delighted to have you here. Lindsay is from the Vera Institute, where she started just this past April 2015 as a fellow and a research associate. Her job is to launch the Project for Gender Equity in Health and Justice, with a special focus on quality care for girls of color. Prior to joining Vera, Lindsay was awarded the Ms. Foundation for Women Fellowship. That was a mid-career fellowship that was really designed to be a catalyst for the work of emerging leaders in the feminist movement and to seed projects in neglected areas of women's rights. While at the Ms. Foundation, her policy and advocacy work and really focused on girl survivors of sexual and physical abuse in foster care and in the juvenile justice system. And she, as we mentioned, was co-author of this new report, which is a publication of the Georgetown Law Center on Poverty and Inequity. Her previous work at the Center for American Progress focused on the impact of Affordable Care Act on access and quality of health care for key constituencies, including young people, women, and communities of color. So as you can see, Lindsay's in a long-term position to speak to these issues, and we, again, very much welcome her to this web conference to present this new report. Lindsay? Lindsay, again, we apologize for the technical difficulties and hope that people are able to hear you and learn about this great new resource.
No problem. And I have to say that with all these technical difficulties, I feel like that's so much of what we've been dealing with on this issue for a long time, is decades and decades of very fierce advocates screaming in the wind.
Enter your password.
Of girls who are victims of sexual abuse, and also LGBT youth and boys. But the focus of my work is on girls of color, without getting anywhere. And then all of a sudden it seems like the sound barrier is broken. And I think breaking that sound barrier is part of what the goal was of this report, was just getting through. So there's been decades and decades of research showing
Enter your
the majority
password.
of women and girls who are incarcerated are sexual abuse survivors. It's one of the most consistent findings in the sexual abuse research, as we'll discuss today. So really what we wanted to do with this report is to name the problem. So the school to prison pipeline language was very successful in distilling a large body of research and information into just 3
Enter your
words,
password.
so that people had a framework and a reference point for talking about these issues in the context of broader reform. And so the goal, the top line goal of this report, was to name the problem and to break through the sound barrier so that we can make it clear and draw people in that maybe weren't as aware of the profound connection between sexual violence and incarceration. And I need to thank the Ms. Foundation, who I know also supports PreventConnect, and the host here today, because they've been such an important part of really moving this issue forward. As I said, the research started through my fellowship with the Ms. Foundation, and the report launched just at the conclusion of my fellowship. It's accomplished so far exactly what we hoped, which was just to shine light on decades of research. The President gave a speech last Saturday night at the Congressional Black Caucus, which was focused on the needs of Black women and the challenges that they still face in a reform context, particularly in criminal justice that's heavily focused on men and boys. And he actually used the sexual abuse to prison pipeline language, and we were just so thrilled to hear it getting that level of policy attention in front of a national audience. So what I wanted to do today is just give you an overview of what we mean by the sexual abuse to prison pipeline, some of the policy drivers that are influencing the systematic incarceration of girls who are survivors of sexual abuse, review some of the research that is in the report, and then talk about solutions. And I have to say the solutions piece is what I'm most excited about, because I think what we draw attention to in this report is only emphasizes the importance of the work that you do to prevent sexual violence in the first place, whereas what we're doing in trying to disrupt the sexual abuse to prison pipeline, while it's very important, is survival work that's trying to manage the consequences of that root problem. So a couple of examples of the policy drivers that we discussed in the report that make up the sexual abuse to prison pipeline. Well, I just want to back up and say, for a long time, even though there has been research showing that the majority of women and girls who are incarcerated have experienced sexual abuse, the kind of common wisdom has been that sexual abuse survivors behave in ways that are problematic that then naturally lead to incarceration. So it's either substance abuse or some other type of vulnerable situation that leads to their incarceration, but it's not the way that we respond to abuse itself that causes the incarceration. And what we say in this report is that, yes, it's true that survivors of sexual violence often engage in behaviors that do increase their risk of incarceration, but it's not that simple. There are policy drivers and policy choices that have been made that facilitate that criminalization when there is an alternative response. When violence against girls and the criminalization of girls should be understood as a public health problem before it's understood as a criminal justice problem. So I think the simplest example is when girls who are victims of sex trafficking are arrested and incarcerated on prostitution charges. There are currently only 20 states that have safe harbor laws for minors who have been commercially sexually exploited, and of those, only 11 have decriminalized prostitution for minors. So that means it's possible for a girl who cannot legally consent to sex and who's being bought and sold, whether it's for survival or because she's being coerced into it, can be arrested and charged with a crime and incarcerated. And it's difficult to get a sense of the scale of that problem because often in an attempt to either avoid stigmatizing young women or for other reasons, they charge girls with related crimes. So the offense might not be prostitution itself, it might be loitering or whatever, but it's related to the experience of being a victim itself, and that is a policy choice to respond to minors who are living on the street or who are being abused by incarcerating them. Another common example is status offenses. So status offense behaviors are things which are not criminal except for the person's age. So these are things like running away from home, truancy, and so the children are incarcerated on these offenses, even though the best practices we know should be to divert them from the system and that they shouldn't spend any time in handcuffs or in jail. And girls are more likely than boys to be arrested on these offenses, and once they are arrested, they're also more likely to be held in jail for a longer period of time. There was a Texas study that just came out last week showing profound disparities in the amount of time served in prison or in juvenile detention centers for status offenses. Another main driver of the sexual abuse to prison pipeline is the child welfare system. And later on we'll talk about the role of child welfare and prevention, which I think we're used to conceiving as child welfare's role in primary prevention in the community. And I think that there's another piece to that equation, which is to think about primary prevention of sexual abuse in foster care group homes, for example, because we are hearing from girls, even though there's very little research, that one of the things that motivates their running away from foster care is sexual abuse in foster care group homes. And there's some preliminary research to back that up. So thinking about how we can apply sexual abuse primary prevention practices to the child welfare system itself inside, not just in the community. So moving forward a little bit, just to give you an overview of the research. The report was based on focus groups conducted by Shakira Washington of the Human Rights Project for Girls, and also our own sort of informal conversations with girls over the years. But we also completed a literature review of just everything that's out there on sexual abuse histories of girls in the juvenile justice system. And up to 81% of the girls in the juvenile justice system endorse a history of sexual abuse. Studies have found a rate that's closer to 25%, but the studies that find the lower prevalence rates tend to use survey questionnaires and not diagnostic interviews. And we know because sexual violence is so notoriously underreported that when you do it that way, you typically get an underestimate. The rate is consistently found in the research to be 4 times higher than the rate endorsed by boys in the juvenile justice system, although if you compare boys in the juvenile justice system to their peers in the community, you would see a disparity in the rates of sexual violence that they've been exposed to. And another startling finding in the research is that this begins early and that the prevalence estimate itself, up to 81% of girls being sexually abused, doesn't really capture the picture, because this is severe sexual abuse that begins on average between 5 and 7 years old, depending on which study you're looking at. And it's usually multiple forms, multiple perpetrators over a long period of time prior to the time these girls enter the juvenile justice system between 11 and 15 years old. So we know very little nationally about girls in the juvenile justice system. We know very little about their health needs. We know very little about their identities. We know very little about their abuse histories. All of the research that we have is from local and regional studies. And the findings are consistent enough and have been consistent and replicated over such a long period of time in those local and regional studies that we can speak to this problem, but we really need a lot more research. We need a national profile, and we need to really drill in on what the connections are beyond some of the policy drivers that I've outlined here and some of the reactive behaviors that you heard Joan describe earlier. And then, so I'll talk a little bit about just the cycle of abuse and imprisonment that happens in the juvenile justice system. So You heard Joan talk a little bit about adverse childhood experiences. Well, these girls have experienced severe sexual abuse, usually in combination with other forms of abuse. And ways that they react to that are running away from home, as I mentioned, skipping school. Because of their abuse history, they're much more vulnerable to trafficking, whether it's in a child welfare group home, which we know that traffickers target because they're aware of both the emotional and physical vulnerability of those girls. And the trauma is often not addressed in the community or in the foster care group home, particularly because of sexual violence not being identified. And then those behaviors become criminalized in the way that I've described. And so there's been great work, on the Prison Rape Elimination Act to think about preventing violence in prison and trying to do risk assessment at the front end to make sure that, people with who are vulnerable to sexual abuse, who have a history of victimization, are not placed, on the same housing unit or protected from people that may potentially have risk of perpetration. But the ways the screening is happening at the front end is often, especially for children, not with validated assessments, right? So often what it looks like is that a correctional officer will interview a child in the midst of them entering the facility, just having been strip searched, handcuffed, isolated from their family. They're probably already terrified based on what's already happened to them in the community. And there really is, there are ways to reduce trauma in those circumstances, but they are inherently traumatizing circumstances that are re-triggering everything. So the likelihood that a child will endorse a history of sexual abuse at the front end in juvenile justice intake in the way that it's currently being done is not high, and so that's something that we need to work on as we're going forward with the Prison Rape Elimination Act. Most of the research shows that holding children in secure settings, isolating them from their family, removing them from their community actually makes their problems worse. And so if we could go back, we sort of skipped ahead, but I was just trying to show that so once they're released into the community with this unaddressed trauma, the same patterns begin again. They haven't had a chance to engage with their family, move forward from the same circumstances that brought them in before. And of course, when you look at adult women in the criminal justice system, there's, over 90% of them are also victims of sexual violence, and there's a lot of overlap, even though there hasn't been a lot of research between girls in the juvenile justice system and the life course trajectory towards adult imprisonment. And the burden falls on girls of color the hardest. So the slide that you're looking at is a per capita rate of involvement with the juvenile justice system for girls of color, and you can see that African American girls are incarcerated at a rate of 123 per 100,000 compared to 179 of Native American girls, 11% of Asian girls, and 37% of non-Hispanic white girls. And I want to flag that the number for Latina girls is likely an underestimate because of the way that race and ethnicity data is collected in the juvenile justice system doesn't adequately disaggregate race from ethnicity. So there's a racial justice implication here when we're thinking about the sexual abuse to prison pipeline. And as I mentioned earlier, it's sort of the overlap of two silences, with child sexual abuse being a silenced issue and incarcerated women and girls being a silenced issue. The lives of girls that are living at that intersection who are being incarcerated are often invisible, and so that's kind of what we wanted to raise up in this report by synthesizing the research that currently exists. And I should say, I don't have a slide, but there was recently a study of 6 juvenile justice jurisdictions around the country, which included more than 1,400 girls, and of those, 40% identified as LGBT or gender nonconforming in some way. So really, again, it's at the intersection of all these oppressions that we see this really vicious cycle playing out, where people who start out being children who are victims of abuse are just funneled into this cycle of punitive measures rather than receiving the treatment that they need. And so, the least common denominator is that we don't want them to be incarcerated. We don't want them to be in jail. But we also want them to have the opportunity to thrive, right? Like the real picture here is that we want to take them from that crisis moment in their life and move them forward. But instead, with these punitive measures in place, the slide that you have in front of you is actually one of the gravest disparities, which is early mortality for youth in the juvenile justice system. So girls exiting the juvenile justice system are 5 times more likely to die in early adulthood than their peers outside the system. For Latina girls, that figure is 9 times as likely to die. If you look on the left, the blue bars are the causes of death for boys, who are 3 times as likely to die as their peers in the general population, and the cause is primarily homicide. Whereas if you look at the slide on the right, which is pink, which is for girls, homicide plays a role, but so does drug abuse and suicide, which are some of the common symptoms of abuse, which are ways that women and girls internalize violence. And they're preventable causes of death. And I mean, homicide, firearm homicide is preventable too, but we need to really be paying attention just from a purely public health standpoint about these gender-specific differences when we think about public health alternatives to incarceration that keep people out of the justice system on the front end. But also on the release side, how do we do reentry planning that is inclusive of victims of violence and their gender-specific needs? You know, obviously what you don't see here is, you know, the unique influence of incarceration on the lives of gender nonconforming people who don't fall into this pink or blue category. But I just put this up here as a stark reminder. This was a 16-year longitudinal study out of Northwestern that had these findings, and the link there is at the bottom if you're interested in reading the full article. So before we talk about solutions, I wanted to put a poll up and give everyone the opportunity to answer the question of how have you ever worked with the child welfare system on sexual abuse prevention, because that will sort of target some of how I frame the solutions in the following slides, and I'd love to learn more about who's on the call and the work that you're doing. And while we're waiting for the answers, I see someone in the text box said, Nancy Bradley says 45% is way too high. It's shocking, I know, but it's not inconsistent with previous research that's been done and with the research I'm familiar with in New York City. I think the important thing to remember is we're not saying that all 40% of those girls are lesbian, gay, bi, or transgender, but they do identify as gender nonconforming, meaning that they don't feel like they fit in the gender binary. They may be tomboys who present as masculine, and so therefore, you know, feel like they don't fit into like the traditional understanding of what it means to be a girl. So I think when we understand that statistic that 40% of girls in the juvenile justice system identify as LGBT or gender nonconforming, we have to understand that part of what's going on in the juvenile justice system is also the policing of gender norms, and these girls feel that very strongly. Oh, I see. You just meant that it was too high. So do we have, I agree with you, way too high. But do we have the polling results from the question?
Yes, we do. We have 65% that have responded that they've not worked with the child welfare system on sexual abuse prevention.
Okay, great. So that means a significant chunk of you have, and I'm sorry we don't have a follow-up question, but if you could chat into the chat box, those of you that have worked with the child welfare system and sort of describe what some of that work is, I would love to hear more about it. So moving on, most of the work that I do here at the Vera Institute and following off the report is in thinking about sort of secondary and tertiary prevention, right? So once youth are entering the foster care or juvenile justice system, how do we put policies and practices in place that give them the best chance of springboarding back out into the public health system and staying out of systems that are punitive? But again, I think if you really wrestle with the fact that sexual abuse is a primary cause, then we have to think about how do we prevent sexual violence to prevent incarceration. I think we need to be operating on all of these layers, you know, because there's a lot going on even in addition to the sexual abuse in their lives that, you know, increases their risk of juvenile justice involvement. But as I mentioned before, so primary prevention in child welfare. I have never been in an interview or focus group or informal conversation with a group of girls where the topic of sexual abuse in foster care hasn't come up. And that's horrifying because our child welfare system, I mean, it's horrifying in general, but it's horrifying because our child welfare system is our system of child protection. It's where we put children who we say have been abused and need protection. And what we're finding is not only does being a child welfare involved youth, being in a child welfare group home, which we discuss at length in the report, increase your risk of being arrested. If you're a girl, it seems to put you at risk of sexual abuse, whether it's in the context of your foster family or whether it's in the context of your group home. And I want to suggest that there are probably a small number of agencies, foster parents, and group homes that are culpable in this because there are certainly champions throughout the child welfare system that are really trying to support adolescents and children in child welfare to move forward into an independent life. But unlike, the Prison Rape Elimination Act, which gives us national statistics on rape in the prison system, it gives us best practices and guidelines for how to handle sexual violence in prison settings, there is no such thing in child welfare. There is no systematic data collection, grievance process that can be relied upon. And girls often feel like they're just dropped off in a stranger's home and no one comes to check on them. They're not safe, and so they run away. And for far too many girls, that seems to be the trajectory from foster care to juvenile justice system. So I would encourage everyone on this call who has expertise in sexual violence prevention to think about ways that you can work with your child welfare system, not only around preventing child sexual abuse in the community, which is very important work, but to help them think about internally to their system, how are they putting practices in place to make sure that they're keeping children safe rather than compounding the abuse that they've experienced beforehand. When the FBI did a sting on child trafficking, way too many, the majority of the youth who they picked up in several stings actually have a history of being involved in child welfare. And so these are youth who are known to the system, and it's really unclear whether they were sexually abused for the first time in foster care, whether it was before entering foster care, and how that then led them to trafficking. But it's something that we really need to pay attention to if we really hope to move this issue forward, particularly given the overlap between juvenile justice and foster care. On primary and secondary prevention, I think the healthcare system is the work that we're starting to move into at Vera to think about how screening in the medical context, which you all may know a lot about, can help prevent sexual violence if primary care providers are working with families and helping them to understand vulnerabilities, but also can potentially detect this sooner. So there's a project called the Young Women's Empowerment Project in Chicago. It's a youth-led project, and they did participatory action research with youth who had been involved in the system or who were living on the streets in Chicago. And they asked the youth, like, who's the primary perpetrator of violence in your life? And they, of course, expected that law enforcement would be a big part of that, and law enforcement was the #1 perpetrator. But second to that, the biggest perpetrator of structural violence was the healthcare system, where youth who were living on the streets and needed help tried to go to a community health clinic, and because of the way that they looked or the way that they were dressed and stereotypes about that, they were often seen as troublemakers and perpetrators. Sometimes the health clinics called the police on them, and so they felt like they had nowhere to turn for help. So working with the healthcare system to make sure that they know how to respond and identify when they see a child who's been through this, and instead of turning them away from a place where they could receive services that might help keep them out of the system. And then we're doing a lot of work that's internal to the criminal justice system to try, as I said, to springboard kids out. But for the purposes of this call, I think I'd like to keep it focused on prevention as much as possible. And so I wanted to present just a tool, which is one of the promising practices, though, that we're using in the juvenile justice system that we think could be applied outside the system, and that is the Girls Health Screen. The Girls Health Screen is the only validated health screening tool for girls in high-risk settings, and that includes juvenile justice and foster care. It was validated with girls 11 to 17. It's self-administered on an iPad with very simple, youth-friendly questions, and girls were involved in designing the questions. It's an integrated mental health, physical health, reproductive health, and urgent case management screen that takes about 10 to 15 minutes. And girls, it's been tested against having a person, an adult, ask them the same questions, whether it's a nurse or a correctional officer, and girls always feel more comfortable disclosing to the machine. It gives more privacy. And so some of the data that's been collected around that is startling. It's the first data that we've ever had on what girls' health needs look like at intake into juvenile justice, which you see on this slide, sort of a subset of the findings. So 28% had a history of self-harm. 22% had been sexually assaulted in the last 7 days, which is really eye-opening, right, to think about. We know that there's this profound prevalence of sexual abuse, but to realize that for almost a quarter of them, that sexual abuse is happening in the midst of the immediate events, preceding their arrest, I think speaks to the immediate connection between the abuse and incarceration for these vulnerable girls. Some of these other, like asthma, is just an indicator of the fact that they aren't, that they're facing health disparities in general. But one of the findings that's not on here is actually that 41% of them had a vaginal or anal injury that was consistent with sexual assault. So from a medical point of view, it's a very specialized population. Doing a combination of the self-administered screen with a physical exam allows an opportunity to identify physical indicators that might allow a physician to refer someone to speak to a social worker, even if they haven't endorsed a history of abuse, just based on, sort of the markers in their body to give them that opportunity if they want it. And it allows for the providers to see the connection between the way that that trauma, emotional, mental trauma, physical trauma, the way it lives in the body, and the way that it's related to some of the other behaviors that girls are engaging in, whether it's IV drug use or, self-harming. So we are hoping that using this tool in the juvenile justice system to more accurately identify what the girls are struggling with and to plan more individualized care on the reentry side into community by connecting them to community health centers, we can prevent them from recidivating. It's currently the universal screening tool in Los Angeles County, and we're looking in New York City at not only using it in juvenile detention, but also using it in foster care as a way of potentially preventing the crossover from foster care to juvenile justice by identifying when a girl has been abused. But we're also working on other solutions, such as potentially developing kind of a crisis app where a girl might be able to choose, whether they call the police or they call Child Protective Services or a rape crisis center, but to facilitate resources in the girls, to connect girls to resources in the community if they're being abused in child welfare. But we have great hope that these self-administered and technology-based solutions can help empower girls by putting a lot of control over the information in their hands. So when a girl takes the Girls Health Screen, rather than it just living in a database inside the agency or inside the prison, she gets access to her own medical records, so she can see what she's been diagnosed with and hopefully use that, because we have seen girls have to pay per page for their health records. They want to take control over this aspect of their life, and they haven't been able to. So that's one way of centering the girls and doing survivor-led work. So I wanted to stop now and just sort of give you an opportunity to say how the sexual abuse to prison pipeline relates to your work, and whether there's any opportunities for something like the Girls Health Screen to be used in other community contexts to be much more prevention focused, because one of the questions that comes up in every group I present to on the Girls Health Screen is, so why is it just for incarcerated girls? Why isn't it in every single primary care practice? I'll give folks a minute to respond. I don't know, Cordelia or Joan, if you have any questions. I know we blew through a lot of information. I got going kind of fast because of our technical difficulties earlier. I wanted to make sure we had time for discussion.
Yeah, this is Joan, and yes, I think we're doing. We're doing great. I think you probably have, I think, from your slides, just a few more minutes. I think 10 more minutes or so at most, and that was slowly just a good 10, 15 minutes plus closing questions. So I think we're good on time.
Okay. Well, I mean, I think we're sort of at discussion point now. I think I blew through my slides. I can talk more if folks have specific questions about anything I presented on. I just sort of jumped the gun, I think, because I was so worried about time from the.
Okay, and we also have some answers for your questions too, Lindsay.
Oh, okay, great.
Great. So just in terms of just to give you a little bit of break from your talking, like we're getting some really interesting responses here. So we have, I don't know if you want me to. I'm happy to go through some of these and just.
That would be great.
Okay, great. So just like someone works at works to support youth in foster care, and she works closely with the county social workers. That the healthcare industry seems to rely on models, and they still sort of blame the victims. So it's not safe. And I think that this person has written a lot about the importance of not just speaking about trauma-informed care, but actually making sure it's more than a buzzword, actually making sure it's effective. Other people have talked about providing prevention risk reduction programs to young women 15 to 25 and that are trauma-informed. And it's the same there. Someone else responded saying they conducted forensic exams on patients ages 13 and up to prisoners and civilians. And the highest age group is 14 to 30 years old. So the patients share their history of violence, certainly as a child in that same interview as well. So there's a lot of really wonderful, I think, ways that people are incorporating this. And I know for me personally, it seems like, that you're just the research that you're finding with this screening tool that only takes a few minutes really is, I think, giving us some data that at least I personally have not seen before in my 25 years in this work.
Mm-hmm. Hi,
so
can you hear me? This is Cordelia.
Go ahead.
Yes, we can.
I just went, okay, I was trying to jump in earlier, and I realized I had been muted again. So just want to check in, and I want to start, as we jump into this discussion by Lindsay, thanking you because you did such an amazing job coming off from all those technical glitches, and thank everybody for hanging in with us. Lively chat during that. But Raina Crow early on, one of the questions, and then it's a theme throughout that I wanted to reflect on and hear from you, Lindsay, because you brought it up at the end, and she raised early on the question about how easy it is for grassroots survivors who've really experienced a lot of these issues to be crowded out of the field by systems or by some of the other programs. And how do we really have honest survivor-informed practices and survivor leadership? And right at the end, you had made a comment, Lindsay, about survivor leadership and how we have these voices more. So I was curious about your ideas about that.
Yeah, I mean, I think there's a lot of different ways of doing it. The Girls Health Screen, like I said, when Leslie Akoka and the Children's Hospital of Philadelphia were developing that tool, they did very actively engage girls in trying to understand what questions they would feel comfortable asking. I know in my own work I'm trying to engage youth as much as possible to understand what are the tools that would be most helpful. I think particularly when we're talking about youth, it is challenging because you don't want to place undue burden on their time when they're already dealing with so much by, trying to then have them come up with these system solutions. And also when they do that, you need to compensate them for that. So at Vera, we have something called the Juvenile Justice Advisory Board, which is a paid advisory board of youth who were involved in the system and also adults who inform our adult work. That was a pilot, and it went well, and so we're hoping to expand it and make it a regular part of the work that we do here at Vera. I think the participatory action research model is great when you have the opportunity to do it, which is to engage with the community and allow them to sort of design the research questions themselves and just support them in answering the questions, so that when we do come up with solutions, they are as informed by the community who they're meant to help as possible, rather than coming up with a great idea that sounds like a great idea to folks who've never experienced incarceration, but then have a whole host of unintended consequences on the ground. But I think we definitely need to do a lot more to lift up survivor-led work, particularly at this intersection of incarceration and sexual violence.
And one of the people had raised that Irina had also been specifically also asking about adults, that happens to adult survivors who are trying to be heard, as well as youth.
Certainly, yes. Yeah, that's an unfortunate reality in the field, and I think I'd be curious to hear from others if they have best practices on that. But to the best of my knowledge, it's just trying to make sure that they are in leadership positions and really the driving force behind the work, and also just vetting work with people that have lived these experiences. Because I know some survivors, it's too much. They don't want it to be their day job, but they do want to still have a voice in this field, and so making room for that too is important.
And very related to that, there was a number of comments about trauma-informed care and how many people now are saying they're trauma-informed, but several different comments about that often feels like it's not real, or if that training has really been there, that it doesn't really feel like it's practiced or put into place. Do you have any helpful hints or guidelines about that now? Because more people are understanding they need to say, or enough to say that they're trauma-informed.
Yeah, I mean, I think it's very challenging to really change the culture of a system. So it's one thing to understand intellectually what trauma-informed practice is, and another thing to really know what it looks like. So you might understand on paper, why a girl might be resistant to commands, right? But then when you're in a juvenile justice facility and you need to engage with a young woman and you just feel like she's not listening to you, it's all that training can often go right out the window. And I think one of the biggest challenges in both child welfare and juvenile justice is that the staff who are working with youth often have similar trauma backgrounds to the youth that they're working with, and haven't had any opportunity to cope with that on their own and do work around that. So I think really acknowledging that and making sure that when people are working with youth that they have had the opportunities to do self-work on trauma is really important. But it's just repetition and ongoing exploration and new models, and I think that it's inextricably linked to the survivor-led work that we were talking about, where one of the biggest trauma-informed principles is agency, and you can't have that if you're not engaging, if you're just throwing solutions at people without engaging them in what sorts of things they believe would be most helpful to them.
Lindsay, this is Joan. One other question that came up here was that in terms of you're using the healthcare screening, how does that apply or comply actually with HIPAA laws? And if you can maybe explain a little bit about asking these questions and then giving them access to their information. Can you just maybe talk about that a little bit?
Yeah, so that's very complicated and varies by jurisdiction. So, and that's one of the reasons why it's taken a lot of time to get the screen up and running in LA County, was that they had to go through this extensive memorandum of understanding with the city around where the data was warehoused and how it was used, and also making sure that the tools were in compliance. And the passport technology, which is what the health records that the girl would have access to is still in development, in part because of figuring out how to do it within compliance of the in compliance with HIPAA. But at the end of the day, she owns her own health information, and we're starting with that principle, that if the girls are going to be asked all these questions, that they should benefit from it, and they shouldn't feel like every time they seek help, whether it's in a homeless shelter or in a community center, they have to answer the same questions over and over again and experience no continuity of care. And those issues are obviously much bigger than just giving her health record, but that's certainly one piece of it. But Vera, beyond the Girls Health Screen, has done a lot of work around how to use electronic health records in correctional settings. We believe that in general, electronic health records are useful, but when it comes to correctional settings, electronic health records are a human rights tool because people who are incarcerated are so cut off from general community health care, and there's no way to provide quality care for them without having a health record. So we created a resource bank called Justice and Health Connect, which predated my time here at Vera, but it has all kinds of great tools around how to go through the legal process to make sure that you can share data with clients and across systems in compliance with HIPAA so that we can facilitate the kind of work that needs to be done.
And you said that was Justice Health Connect? Is that?
Yeah, Justice and Health Connect. It's also, if you go to vera.org, it's at the bottom of the web page. I think you can click through to it.
One of the other things I know you addressed in your report and recommendations, but there were a couple comments about, again, was, and see if you have any, where you think we're at in getting more highly specialized foster care, the right kind of training for foster care, the right kind of screening. What do you see happening around that?
I think we're in an interesting moment. I mean, just like the size of the juvenile justice population has gone down, the size of the foster care population has also gone down. I think there still needs to be more work to restructure the way that child welfare is paid for so that we can do much more family intervention and preservation work and prevention work rather than just removing youth from their home and putting them in situations that aren't necessarily safer or better than where they came from. But there will always be girls and youth that can't go home, and we also are in a time of trying to figure out what a viable alternative looks like, especially for older youth in the child welfare system who can't go home. And actually we're doing focus groups right now with girls in New York City to try to design what it is that they want, what it is that they feel like they would need that has the right level of independence and the right level of support to facilitate their transition to adulthood if they don't have a family that they can go back to, and if they don't want to be adopted or have an appropriate adoptive family that they can be connected to. And there's sort of unrelated to that, interesting work that's going on around trying to create rock star case managers. So we know that child welfare workers are very overburdened and unsupported, underpaid. They don't have the training they need, and the caseloads are not manageable and out of compliance with, what we know from research needs to be the case. So there are projects around the country that are working on investing in child welfare workers and evaluating what works to make sure that they have the tools that they need. But I think it's still too patchwork and sporadic to say that it's becoming widespread practice. But I think it's optimistic and hopeful that if we do that and if we invest appropriately in the people that are doing the work, that we'll start to see the benefits for youth.
I love that concept of sort of rock star case managers. I hadn't quite heard that one before. I'm wondering, one of the things, at least for me, that was so powerful about some of this data and so what you were able to share in terms of this, these initial screening tools. And I'm reading through all of the different ways that people either see how they could also use this screening tool as well. can you give suggestions? How would people begin to share data either with each other and with you, so that, because I think that what's so powerful that you've been able to collect this on a, not just an individual facility, but sort of across, across the country, across the entire state. So how would people share some of the data if they start using this screening tool as you're suggesting?
So there's a lot of work. So first of all, I keep meaning to say and haven't said that the person who created the Girls Health Screen is Lindsay Pulse at the National Girls Health and Justice Institute in California with support from the California Endowment. And they just got so it took a long time to develop the tool and first make sure that, because it functions as a medical triage at juvenile justice intake. So, it'll tell the provider this, issue flagged red, so the child has to go to the hospital immediately, or this issue flagged yellow, you have 72 hours. And it really requires the whole facility sort of changing how they do intake and how they respond to someone who's coming in to the facility. And so because of that, it's really tailored to high-risk secure settings. But we're looking at ways also in New York City to adapt it more to community settings and to make it globally gender responsive. So, if you have a trans girl or if you have a trans boy, let's say, in a female facility, taking something like the Girls Health Screen isn't going to be very affirming for him. So we're working on creating a tool that's similar to the Girls Health Screen, uses actually the Girls Health Screen for cisgender girls, but then has a front screen that can disaggregate biology from sexual orientation, from gender identity, in order to be universal, to be used in male and female facilities, and respond to youth where they are, regardless of how they identify. So it's kind of a tangent and not what you asked, but I just wanted to put that out there, that it really is designed for secure settings. But I think that the self-administration research on the importance of or the impact for youth in giving them the opportunity to answer questions for an iPad, I think is universal and not only specific to the Girls Health Screen. So you could envision using other screening tools that your agency already has in place, but just changing the format to see how that changes the level of comfort and reduces trauma for the people that are coming into the facility by making it less stressful. Like, so right now, child welfare screening, in a lot of places, you have a child sitting across from 5 adults who they don't know, asking them all kinds of questions, and that in itself can be very traumatic. But in terms of sharing the data, the way that it's structured in LA, it's both an administrative data set for the facility, so they can in real time get the sense of what's going on with their population globally, and tailor services accordingly is the hope that that's what will happen. And then giving the girl her own data, and over time giving researchers the data that they need to understand more about girls, because they're excluded from most of the medical research that's out there. I mean, we really know so little, but when you look at those early mortality slides, there's a lot to know. So I think sharing data across states is complicated, but I think technology and having a centralized data system is part of it, and making sure that the privacy protections are in place, which is why we have Justice and Health Connect there. But anyone who's interested in learning more about the Girls Health Screen and ways of potentially implementing it in your jurisdiction, I'd be happy to facilitate a connection to Lindsay Pulse, or talk to you a little bit more about what I'm calling the Gender 360 screen tentatively that we're developing here at Vera, which is a partnership with Lindsay Pulse.
I'm very excited to learn more about that, and I want to loop us back to where we started, as well as lead us into action thinking. And one of the issues for those of us who have been at this a long time is that it's just really been hard to get and keep sustained attention to not only understanding the problem of child sexual abuse, but to really mustering up the will to prevent that and to recognize the reality of the effects, especially as you've drawn out in this report and others, to girls of color, marginalized communities. And what as we start thinking about an action like everybody to start thinking about an action that you can take as a result of some of the lessons in this report. And you may want to answer a different kind of action, Lindsay, but I'm wondering if you can think of any ways that we can help use this report and the information in it just to get that urgency attention to child sexual abuse.
Right. I mean, I think our top line goal, like I said, was the language. And we think that that language can be used in so many contexts, whether you're talking about the adult criminal justice system, whether you're talking about policing of the transgender community, whether you're talking about immigration enforcement and the ways that women and people who are fleeing violence are being shoved into immigrant detention centers. So we hope people will use the language, and because it, much in the way that the school to prison pipeline really caused the field to generate a lot of attention there, we think like at this particular intersection for the juvenile justice system, having that language is so important, because there's been a lot of work around children exposed to violence, but I think within that sexual violence and the particularly gendered flavor of sexual violence, well, flavor is probably a bad word to use, but anyway, the gendered context of sexual violence and the specific impacts that it has are kind of lost in that situation. And you look at the adverse childhood experiences research, as you probably most of you on the phone know, right? Like that's the one form of abuse that really seems to have like its own unique consequences, and whereas the rest of it is sort of a dose response to the different, the type matters less than how much different kinds of forms of abuse you've experienced. But I think, beyond using the language, we wrote the report to try to give as many sort of intersectional jumping off points, because the reality is it's not going to be one movement, I think, to end child sexual abuse. It's going to have to be a lot of different movements. So you have people on this phone call who are working on PREA and others who are working in the community. And I think what we tried to do in that report is sort of frame where the policy intersection is, if you're someone who's working on child abuse prevention, or if you're somebody who's working on juvenile justice reform, or you're somebody who's working in public health, that there's a starting point mapped out in that report to think about how this specific population that's so often left behind and swept under the rug fits into the work that you're already doing, so that you can carry that forward. And I think the more that movements in different contexts integrate this population, because there are so many connections, that's kind of how we generate the momentum. Or at least that was the theory behind the report and creating the language. So.
Great, and as Joan, you're probably seeing, there's a whole series of responses that are very, very exciting about how people plan to take action and use this report in their education, in their bringing it back to their committees, bringing it back to their organizations, just looking at how they can really help use this to sensitize people to the different issues that they're working with. So there's a lot of excitement about the report.
Yeah, and I also love seeing people saying that, certainly the more we have information about the impact, the better we can actually create our prevention programs. And so we see exactly what the impact is, and how often, I think for me, like the questions around their experiences, even just 7 days before they enter facility, really sort of, I think, in my mind, is an amazing wake-up call that I don't think I've seen that kind of data before. So maybe moving to the next slide. I think one of the, and Cordelia, I can't do that, so if you could do that for me.
I'm there. Sorry.
Okay. No, that's great. Thank you. So one of the things that we'd like to sort of ask, both of the audience and also of you, Lindsay, is what do you think is like, what is the really one takeaway that, if for people who maybe, are tuning back, got lost and are tuning back in, what's the one thing you would hope that people take away from this entire webinar?
Well, I think, as you said, there's been child sexual abuse is an issue where it's hard to keep momentum on it, and I think criminal justice has historically been that issue too. But we're at this very exciting moment where both of the fields of sexual violence prevention and criminal justice work are very energized and are getting national attention from policymakers in the highest office and from grassroots organizers all around the country who are really pushing their communities to change. And I think that there is a lot of overlap between those two fields, I think more than we think about justice and safety. And I hope that this particular population of girls who are stuck in this cycle of sexual violence to incarceration, I hope that that means that this is their moment where people can really dive in and integrate them and capitalize on that momentum to push their needs forward.
Great, thank you. And I know for me, I think what's really hit home for me also is how your concept of really creating a common language and I think goes even much deeper than language, but just a common approach so that we can begin to have these conversations, as you say, across public health, across criminal justice, and so that we begin to sort of understand the implications of what each of us are doing and how they can dovetail together. One of the things that also that we want to make sure that people, because you have generously offered to respond to people if they had other questions or connecting them in terms of the screening tool, this is the contact information for Lindsay, and that also that that there in this report you can download the PowerPoint slides, and you'll see both that this contact information as well as the URL information about how to access the report itself. And I really strongly recommend that everybody take the time to actually read the report. It's not that long. It's very easy to read, and it's very, very important, I think, for all of us to take that information in. And back to you, Cordelia.
Well, also this, just to know that we'll figure out what we do with this first half hour where the recording really didn't work, but I am delighted that so many people hung in, and also that I think by the time we got to Lindsay, more people were able to hear and not be distracted by background parts. So this is going to be recorded. We'll figure out at what point they started at, and the recordings and material from over 20 previous Power in Prevention, these Ending Child Sexual Abuse series can be found at this particular link. And again, that information is available on the website, so you can check into that. This is just so plumb full of very useful information. It's exciting for me to read everything from people looking at how they incorporate this into their PREA work to they incorporate it in their campus work to they're incorporating it in their prenatal care, parenting classes, like a lot of excitement about ways to take this to enrich the efforts that people are doing in many different areas. And we're just very, very thankful to be able to have this here. So I want to take this opportunity now to thank Lindsay again for the work she did as one of the authors on this report, for the preparations and hanging in there with us on this webinar and doing such a great job of pulling out some of the key points. Thank all of you for your patience at hanging in with us through technical difficulties that we have not quite ever experienced before in this way. So Imelda and team at PreventConnect, thank you for all of the troubleshooting. And I have no idea what was and wasn't through in our first opening context, so that was as jumbled as I've ever felt, but it was just so fabulous to get to the core and get to Lindsay and have that be such amazing and important information that I just think can help us really go back to that point of our advocacy and our warrior of saying we must pay attention, we must hear these voices. We cannot allow this to continue without investing in the social, systemic changes needed and that attention to those individual needs. Joan?
Well, thank you so much for having me, and thank you everyone on the call for the important work you're doing to address this issue. It's really inspiring to see so many people join the call today.
Wonderful. Lindsay, it's been a pleasure, and I hope people listen to this webinar again and again. Thanks, everybody, and see people at our next webinar in November. Thanks again, everybody, and thank you, Imelda, and your great team out there, too.
Thank you. Thank you, everyone.
Bye.
This concludes the webinar.